All right, let's do a quick testing before we begin here. Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3. We all good? Perfect. Good morning, everyone. Good morning. Oh, it's afternoon. Yeah, no, it's still morning. Good morning, Chris. It's so good to see you again, and I can't wait to see you this Saturday for your full day class. My name is Donna. If to everyone who I have not met yet, I will be your host and your moderator for today's class. Here at Lettuce Institute of Integrative Medicine, we are the leading CU provider offering the largest selection of CU courses for acupuncturists. And each week we hold a weekly webinar such as today's class. And they're for educational purposes. They do not include CEUs yet, but however, once they're recorded, after a period of time, you'll be able to earn CEUs and purchase the video recording for it. And if for any reason you're not able to attend the weekday webinars, we do record them, as I mentioned, and you can watch them again for free if you like on our TCM Wisdom Tube the next working day. And we also have CEU webinars. Our next weekend webinar is this weekend, and Saturday will be with Chris, and on Sunday we'll be with Dr. Choi, and he's going to be talking about kinetic acupuncture. And again, we do record these classes too, so if you want to earn distant learning CEUs on it, you're more than welcome to. We have videos, audios, and articles. Okay, so today's class is an introduction to Steam the Jade Gate with Kristin Gonzalez. And Chris specializes in women's healing arts. She teaches her female patients how to gain an understanding of their biological rhythms within the lens of Chinese medicine. She educates on gracefully approaching the 7-year cycles of women, menstrual attunement, and longevity medicine. She is a certified healer within practice leader from the Institute of Internal Qigong and Tai Chi. She is also the resident acupuncturist for Parastem Hydrotherapy Institute, where she provides herbal consultations and education on perineal steaming for healing gynecology and andrological conditions using steam and smoke therapy, also known as fumigation therapy in Chinese medicine. All right, so without further ado, let's go ahead and give her a big warm welcome. And Chris, if you can do a quick testing on your end so we make sure we hear you.
Thanks, Donna. Testing 1, 2, 3. Can everybody hear me?
Yes.
Yay. Okay, good. So at the very beginning I couldn't hear you, so I didn't know if you asked everybody where they're coming in from. So if you haven't done that, it'd be really nice to see where you guys are all coming in from. Boulder, Texas. Hi, everybody. So I'm really curious to actually hear from you guys. If you've heard of steaming, if this is new to you, you can put new, or if you've heard about it, you can put yes. All right. So it's kind of a mixed bag. All right. Okay. So thanks so much, Donna and Sam, for inviting me here and talking with you guys about something that I'm super passionate about. So the question I get a lot is, so I started prescribing steam protocols to my clients pretty early on in my practice. And so the thing that I get asked pretty often is, well, how did you even start that? And is it even within our scope of practice as acupuncturists? And so let's actually dive into that a little bit before we get into the actual presentation. So I grew up with the therapy. My mom is from South Korea, and the practice is pretty prevalent there. You can find it being offered at like the hole-in-the-wall kind of bathhouse in your local town, to kind of really high-end spas in Seoul, Korea, and also being offered in like really high-end fertility clinics. And there's actually a coined phrase for it, and it's being researched in clinical research also. So it's pretty prevalent in South Korea. And so I grew up with the therapy, but it never even crossed my mind to introduce it to my clients because, you know, that's just something that's part of my family lineage. And so it didn't cross my mind to actually integrate it into my practice until much later. So what had happened was I have a friend who is a researcher by trade, and I was in acupuncture school, and she called me asking if I knew what vaginal steaming was, just kind of out of the blue, because she knew that my mother was from South Korea. And she had just gone to a Korean spa in LA to get vaginal steaming because a Mayan abdominal wound healer told her to get one because she was missing her period for 3 months. And so, needless to say, it worked for her. She got her period pretty quickly, I think the same day actually. And so she called me and just kind of picked my brain about it and asked me all about it. And so that's kind of history. Her and I have been collaborating for some time now in really trying to find a way to kind of introduce this therapy to women. And because that's where our kind of passions lie, but it's a therapy that can be used for both men and women. So that's kind of how I started kind of maybe possibly thinking about adding it to my practice, but me being me, I really wanted to feel integrity in actually introducing it to my clients. I wanted to be like absolutely sure that it was part of our, scope of practice. And so I researched it. And I know that Korean traditional medicine and Chinese medicine influenced each other. And so I started digging really, really deep into our ancient texts, and it's there. It's called fumigation therapy. It's not the best name or translation, but that's what we have. So it's within our scope of practice. It's within our history. It's in our ancient texts. It's in a lot of modern texts as well, having to do with gynecology. Let's actually just start kind of talking about it. I know it's new to a lot of you, so let's go ahead and get started. Does anybody have any questions so far? Nope. Okay. All right. So first, I kind of wanted to go over some terminology just to make sure that we're kind of on the same page. So jade gate, it's just a really common term translation for vagina in East Asian literature, and it's the term used a lot in bedroom art. And I know the word vagina or vaginal kind of triggers some people, so that's why I called the talk Jade Gate, steaming the Jade Gate. So steaming, we all know what that is. It's a method of cooking, and for our purposes, we're actually using the mist and the vapor as a healing method. So vaginal yoni steaming, this is a really kind of modern translation to the therapy. And it's not necessarily the best translation because I feel like it kind of triggers some people. But that's okay. That's just kind of what we have to work with because that's what it's kind of being coined as. Yoni steaming is kind of a modern term, but put together. But the word yoni is a Sanskrit word for translated word for vagina or portal. So if you were to research steaming therapy for females or just kind of do a general search, or if you actually researched even deeper in a lot of history texts kind of spanning all cultures, you'll see it called different things in different areas. So in Korea, it's called chayok, which is more about the steam therapy. And then the dry therapy, which is the smoke therapy, is called jwahun therapy. And if you were to go to Indonesia, they call it ratu. In Ayurvedic medicine, they call it yoni dupan. If you were to go to Sudan, they call it dukan. And in several places, when you actually research it, it's just a pelvic bowl bath, pelvic bowl steam, pelvic bowl smoke therapy. So within our medicine, So as I did research in our medicine, it's actually translated as fumigation. And it's not the best term. It's not the most beautiful term or beautiful translation of the therapy. But if you think about what the therapy was actually meant for, then it starts to kind of make sense why they translated it as fumigation. So smoke and steam therapy used externally was used to kind of, it was used way back during like the shamanic times, you know, where they were getting rid of ghosts and demons and so forth, and bugs and parasites. And so if you kind of translate it to modern day, it's like venting out those things that kind of invade the body. So microbes, basically. Yeah, so I think that's why they translate it as fumigation. So fumigation is shun. So within the scope of fumigation, there's different kind of delivery methods. But the one that we're going to focus on is actually steam and drip washing, because that's relevant to what we're actually talking about today, is the steam therapy. So that's translated as shun shi fa. So if you wanted to do your own research in our text, that's what you would actually look up. This actual definition was from Manual of Dermatology. So fumigation therapy is actually part of our external herbal lineage. So it's called Waika. And a lot of the way that we actually practice herbology today is actually mostly, I'd say probably like 90, maybe even 95% internal herbs. But there was this whole subset of practicing herbs for external therapy. And a lot of texts still haven't been translated. There's a few texts out there, but it's a rich source of medicine. And it's really believed that we're kind of missing out on kind of half of our clinical outcomes by leaving out the external application of herbs. And it was believed that to have the highest clinical outcome, you actually used external and internal together. Yeah. All right, moving on. Okay, so why is steam actually used as medicine? So it's like the most humble home remedy there is, and it spans all cultures. And not only using it for the lower pelvic bowl, but just in general, smoke and steam therapy was used as a healing modality. You hear about the sweat lodges in Native American societies. Saunas are just kind of found everywhere in the world. And there's inhalation of steam through the sinuses. And even within Ayurvedic medicine, there's a method of actually inhaling smoke coming off from medicinals, and that being used for healing as well. So it's the most kind of humble home remedy. It's used by everyone, all cultures, all across the world. So we use steam, or I use steam in reproductive wellness for women. Because what I find, and I'm sure a lot of you find also, is that most, if not all, female kind of reproductive issues are due to lack of flow. So either it being, it's like the chicken and egg situation. It's like the patterns that they're experiencing cause the lack of flow. Or the lack of flow causes patterns to happen. So in either case, steam is really beneficial because of what it does. So it introduces warmth and softening and circulation of chi and blood. It opens up pores, it releases the exterior, and it can be used to actually disinfect. This is where kind of herbs come into. So jade gate steaming or vaginal steaming is actually combining the magic of the steam itself, because that can be used just by itself with the efficacy of the herbs. And you can actually tailor your treatments to be a little bit more direct. But I think this is where a lot of confusion comes in, and a lot of trip up about steam therapy is like, well, I don't know what herbs to use. What do I use for this condition, and so forth. And I feel like there's an overcomplication factor that comes into play because of the herb aspect. But we have to remember that steam itself is healing. So a lot of my clients are just steaming with water and a little bit of salt, or they'll just have one herb on hand. So they'll just do like an organic peppermint tea bag. So we'll actually go into further depth about this in the course on Saturday. But I think one of the big kind of hurdles is like, well, I'm not really well versed on herbs, or I don't feel confident about herbs. But you actually don't need to be to actually gain the benefits of this therapy. Yeah. All right, everybody still with me? Say hi. Okay, moving on. Okay, good. Okay, next slide. Okay, so I wanted to talk to you guys about like a holistic approach to reproductive wellness. So even though most of my clients are actually steaming, that's not the only thing that I turn to help them. So it's an adjunctive therapy. It's a complementary therapy to all the other things that we're kind of working on together. So the acupuncture, the internal herbs, the education piece is really huge for me. I want my clients to know how to read their blood. I want them to know about their cycle. I want them to start tracking their cycles and so forth. Food and nutrition therapy according to where they are in their cycle and so forth. So all that in conjunction with the steaming. And the reason I incorporate it so often is because not only is it healing on the physical level, there's this integration factor that happens to a lot of modern women to where they're like, I mean, it feels amazing, but there's such a disconnect between the lower dantian and the upper. We function up here a lot. We're in the mental space all the time. And there's a disconnect to the lower kind of part of our body. It's the furthest away from us, right? And so, I mean, it's no wonder that so many women are experiencing all these really horrific conditions, you know, and fibroids the size of grapefruit and cysts all the time and endometriosis and so forth. There's just such a disconnect, and we don't really have the education to really care for ourselves on a deep level. And that's where our medicine, I feel like, shines, because we have such a vast foundation of information, of wisdom to pass on to our clients so that they can gain that relationship with themselves and integrate the, you know, the upper, middle, and lower. Yeah. So compliance is really high. I don't hear very often from my clients like, oh, I kind of skipped that this month. It just feels really great. It's something that they can kind of add to their post-period ritual, because I teach all my clients how to take care of themselves properly on their period. And so it just kind of integrates really well. It's not something that's kind of a burden. It feels great. It smells great with the, you know, the herbs that we're using and so forth. And it's a direct kind of thing that they can apply to their own health. That feels very direct, you know, and it's a great way to get them on board with their own self-care rituals. Yeah. So Gail asked, how often does one do it? It really depends on the person, and this is the kind of nuances that we're going to go over in the actual in-depth course, because it's different for everybody. I would say, as a good general rule, the way that it's used in South Korea is part of a post-period ritual. So what happens is, after the last day of your bleed and there's no more fresh red bleeding, You steam for, 1 to 3 consecutive days, um, most often in the evening time because it just relaxes you so much and you sleep really well. And that is because it's kind of like that safe time where there's no fresh bleeding. There's no chance to kind of run into any of the cautions or contraindications that we're going to go over. And it really helps to introduce and sustain warmth in the womb, which we want, to kind of help slough off any remaining old residue. So preventing any blood stasis, blood stagnation of any old hormonal information. Yeah, so that's kind of a general answer. Yeah, and also it's compliance is really high because you'll hear from your clients like, I've had this shoulder pain for weeks now, but every time I steam, it just subsides because with the steaming, it does release your exterior a bit. It makes you sweat a little bit. So it has systemic benefits as well. Yeah. All right, moving on. Am I going too fast, you guys? Okay. So, okay, great. Thanks, Wallace. So what is it used for? So the fumigation is for everybody. But for the purpose of this course, I am kind of catering it more for female reproductive issues. So most of the time, it's always indicated for cold type patterns because you're introducing warmth and you're introducing circulation. And a lot of the conditions that kind of come into our practice are cold related in the womb, where circulation is impeded. You'll have clients that describe sharp pain during their menses that shoots down their legs or kind of goes around their whole back, and so forth. So conditions related to lack of flow, dysmenorrhea, amenorrhea, fibroids, endometriosis, pretty much anything in the reproductive area, the womb, the ovarian, or the ovaries, the fallopian tubes, the vaginal opening, and even on the vulva. And because you're steaming the pelvic bowl, you're also reaching the perineum, which accesses the microcosmic orbit. So that's why it has so many systemic benefits. And then you're also reaching the lower digestive tract, so it benefits hemorrhoids really well. And also cases of colitis in kind of inflammatory conditions of the lower bowel, and then also constipation. It really helps with constipation. And for male conditions, there's a really great book, if you don't have it already and you work with men a lot. It's by Bob Demoni, and I think it's something andrological conditions. And they have quite a few, or he has quite a few recipes in there for fumigation, from anything from chronic and acute prostatitis, erectile dysfunction, premature ejaculation, stuff like that. Yeah. All right. Okay, so let's actually go over, and these we'll go over more in depth on Saturday. But just to get a general idea, not everybody is well suited for steaming. There's some really obvious ones and then others that are not so obvious. So there is times when you would never recommend a steam. There are times when you want to be a bit cautious. And then there's other times where you can recommend a steam, but you just have to accommodate their treatment plan a little bit. So the times that you would never recommend a steam is pretty obvious, not during pregnancy. You would never, ever recommend a steam during pregnancy. There are some cultures that actually prescribe a steam to prepare the mom for labor. I personally do not recommend that. I don't have comfort level around that, but it is prominent in some cultures. Another time that you would never steam or recommend steam is when somebody is on their period. So on their actual bleeding days. And so we're actually talking about fresh red bleeding. So if some of your clients, they start and kind of end on brown, almost black, tarry, kind of viscous spotting, that's fine to steam on that, but it's the fresh red spotting that you would never steam with. Let's say you have a hesitant start and a client is kind of cramping and their period is about to start and they have a lot of that brown old residue coming out. You can actually encourage the flow and alleviate some of the cramping by doing steam at that time. Yeah. Okay, another time you would never recommend a steam is when you have clients that have 2 periods a month, or somebody who has a tendency towards spontaneous bleeding, or if they have just continual flooding, like beyond their actual period. So in any of these cases, you would not recommend steaming. It would not be your kind of first choice for that particular client. I would actually say to wait a good 3 months and kind of regulate their cycles and have it be consistent and regular every 28 to 30 days without any kind of intermittent spotting. If they're at that state for a good 3 months, then possibly you could introduce a steaming protocol like post-period just to kind of keep it safe. But for that type of client, maybe you would even wait a little bit longer. It wouldn't be kind of your first choice to go to do a steam kind of plan for them. Yeah. Also, I don't know if everybody knows what TTC means, but trying to conceive. If you have clients that are trying to conceive, you would never have them steam after ovulation. And for obvious reasons, because if they're trying to conceive, they might have actually been successful. So you don't want to introduce steam at that time. So when you talk to your clients about steaming, you do need to educate them a bit about, you know, always ensuring that they don't have any of these situations going on. They're not pregnant, they're not on their period, they're not spotting fresh red blood, and if they're trying to conceive, never to steam after ovulation. Yeah. So other times or times where you would actually be a bit cautious in recommending a steam. So our medicine is really great about actually treating infections. You know, in the vaginal canal, on the external vulva, with herbal medicine. We have really great formulas for that. Kushentong is one of them. The only time I wouldn't recommend an actual steaming of the decoction is if it was burning. If they have burning, then I probably wouldn't recommend a steam. I would actually recommend doing the sitz wash versus the steam. But if they had an infection that was itching with a lot of kind of curdling discharge, we can actually do a steam sitz wash for them. So for infections, we'll go over this in more detail in the course on Saturday, but for infections, I always prescribe 3 things. So you do the steam, you do a sitz bath, and then you also use it as a wash to wash the external vulva. Yeah. Okay, so, but this is just a caution that I recommend that if somebody has anything burning, then I wouldn't necessarily recommend steam as the first thing, more kind of a sitz wash in that situation. If somebody's had their tubes tied or have had them singed, steaming over time has actually shown to soften scar tissue to where it actually kind of falls out. And so if you have a client that has had that procedure done, it could possibly affect the efficacy of the procedure. It could actually kind of open things up or release scar tissue and so forth. So it's best just to kind of rule that out. And it's good to have just like a screening sheet if you intend to actually introduce this into your practice, a screen sheet to kind of screen for these types of things. So like I said here, some sources actually say not to actually fumigate or to prescribe a steam protocol for somebody that has infections. But with our medicine, if somebody comes with an infection, I give them an actual protocol to do the three things. You're going to steam, you're going to sitz bath, and you're going to wash the external vulva, all mildly. So the steam is always a mild setup because you don't want to introduce so much of the steam. So a mild setup would be for about maybe 10 minutes so that you can actually open up the area, soften tension, open the pores, and allow the medicine to actually be absorbed. So that's the purpose of the steam, actually. Okay, so some birth controls, we have to use caution because some birth controls like hormonal IUDs and like the NuvaRing and stuff like that, this is where like modern medicine meets ancient remedies. We don't know how these things kind of interact. And so we have no idea if it affects the hormonal output of these devices. So I just caution around kind of prescribing steam for somebody who has kind of a hormonal influenced birth control method. So there is one arm implant that affects the endometrial lining and the thickness of it to prevent pregnancy. And because steam therapy actually influences the endometrial lining, I would be cautious in using it for somebody who has that arm implant because it could mess with the efficacy of their birth control method, basically. All right. Let's answer some questions. Let's see. So Amy, hi. Do you find steaming useful for vaginal dryness due to menopause? Yeah, absolutely. So I have menopausal clients, postmenopausal clients, who I'd say most of them express that they actually miss their menstrual cycle and just kind of the monthly rhythmic affair of it. And a lot of them do have dryness. And so what I actually prescribe is a really kind of, depending on their constitution, like a very nourishing blend. If they have some heat, then some kind of cooling things like mint would be really nice. But the steam itself actually helps to bring qi and blood to the area and plump up the tissues. So it really helps with that. And normally afterwards, I have them actually put on a serum to kind of lock in the moisture at that point. So yeah, absolutely. Okay, so Judith, while a patient is having a herpes outbreak. Okay, so I think it's in the next slide. Oh yeah, so if they have open sores, so this is called Hu disease, I think, in our medicine. And the formula that's kind of prescribed internally is Ganshao Shishitang, and that's really useful to use internally. So for externally, you can actually use the Kushan Tang to actually really help heal the sores, have them scab over. It helps to disinfect them. So I'd actually, yeah, you can absolutely do it for a herpes outbreak. That's another thing that you should definitely screen for if your client has a tendency towards an outbreak. Because what we're doing with steaming is we're kind of warming up the core of the body and we're inducing a bit of a sweat. So that's body fluids lost. So anytime you recommend a steam, you always want your clients to be hydrating at the same time, just as the same kind of recommendations of if you were to go into a sauna. So if somebody actually has even like oral cold sores or genital herpes, because they're, related. If it actually breaks out on the skin, that indicates severe body fluid deficiency. So if they're also showing other signs of body fluid deficiency, like a dry stomach or stomach pain or just kind of dry in their sensory organs, that's probably not the best time to be steaming because that would further deplete their body fluids and could actually lead to an outbreak. So for those clients, I would actually really, really ensure that their body fluids are intact and that they have methods to kind of keep the outbreaks at bay, and probably not recommend steaming if their immunity is a little bit compromised. You don't want to vent out too much if they're already compromised. And I hope that makes sense. Does that answer your question, Judith? Okay. All right. So some of the accommodations that we need to take into account, we can actually steam for these kinds, so we just have to kind of modify the steam kind of protocol. Okay. So for an IUD, as I said, if they have like the copper one that's non-hormonal, you can actually steam with that, but you have to be very mild. Only the mild steam, 10-minute sessions, 15 at the most, just to kind of help, relax the area, bring tea and blood to the area and warmth. The Nuva ring, I think that's the ring that you can actually take out. So I would actually, they can steam, but they'd have to actually take out, I would want them to take out the Nuva ring before actually steaming. So hot flashes, that's kind of a question that comes up a lot. Can I prescribe steams with a client that has hot flashes? You can, actually. And there's a lot of kind of cooling herbs that you can add to the steam that are not going to introduce so much cold to the lower womb, but just more systemically kind of cool body temperature. And you always make a balanced blend that has like kind of cooling and warming together. And also a mild steam for them. And a lot of times you'll see in like the Korean spas that you have this cloak on you to kind of keep in the warmth. But for patients with hot flashes, they need to play around with the cloak. They need to, if they're actually feeling overheated, probably opt out of the coat and just stay covered in clothes up on top. And yeah, so they'd have to kind of play around with using the cloak or not. But most of the times you don't want a cloak and just do kind of a mild 10-minute steam. And over time, actually, a lot of my clients actually don't have hot flashes anymore. Yeah. So with infections, we do also need to do that mild steam. So the mild steam is like 10 minutes at most. And you normally have them on a treatment protocol, which is kind of 10 rounds of, the 3 things of steaming, sitz, and wash. And that normally takes care of the infection. Yeah, and I just want to answer these questions because they're probably relevant right now. So how hot, warm should the water be for steaming, boiling? So so there's a couple methods to do this. For short steams, all you have to do really is boil the herbs on your stovetop, and then you can actually pour those herbs in another kind of pot and just use the steam off of that. And you always check the temperature with like a really kind of sensitive area with thin skin. So this area right here is really nice to kind of test the temperature of the steam coming up. And if it can be tolerated here, then most likely it can be tolerated down there too. Yeah, and so for more kind of advanced steams or moderate setup, I always have clients have like a burner, or some people actually use a little crock pot to kind of sustain like a low steam. You don't want it to be boiling. So you initially boil it to kind of get the decoction going. But then you actually turn down the heat to just kind of have a very gentle steam coming up. Okay, and then Judith, so not for damp heat. Yeah, you could do it for damp heat, and I know that probably seems a little contradictory. So this is kind of something that we need to kind of demystify with steam therapy because, you know, for example, like let's say your sinuses are all clogged up and you have damp heat conditions, so you have really green, yucky mucus, and it's just so clogged in there because it's so much heat just kind of congealing it in your sinuses. So one of the things that you can do for that is to actually go into your shower and, you know, make it really, really warm in there and moist, and it kind of helps to liquefy and loosen the mucus to kind of come out so that it's not so stagnant and creating even more heat. So if somebody has a really, really damp heat condition, like infectious condition in their vaginal area, vaginal canal, you would still do like a mild setup. So what you're doing with this steam is just opening up, loosening, opening the pores to actually receive that medicine. So we're not actually doing the steam for a really kind of prolonged time. It's very mild. And if you did it excessively, yeah, it could absolutely aggravate a damp heat condition. Yeah. I hope that answers your question, Judith. Okay. So Wallace says, how many minutes is the normal setup? So this really depends on the client. It's not an easy answer. For anybody who has like a lot of deficiency, this is kind of a general thing. If they have a lot of deficiency, very chi deficient, very blood deficient, mild setup, just 10 minutes. That's it. If they have an infection, definitely a mild setup, which is like 10 minutes. If they have pretty regular cycles, they have a robust system, 28, 30-day cycles, or even more than that. It goes way, way long. You know, normal bleeding time, 3 to 5 days. And they're coming in with like dysmenorrhea, really painful periods, clots, so forth. So a length of time would be a nice kind of 20 to 30 minute steam would be appropriate for that person. Yeah. Okay, great. All right, so we talked about kind of when we would accommodate for certain situations. And of course, we're going to go into more depth about that on Saturday. All right. Oh, that's kind of the end of, we can actually talk about more things if you guys have more questions. But so my friend that I talked about at the beginning, her name's Kelly Garza. She's a researcher, and her and I have collaborated in her company, Steamy Chick, which is also Peristeam Hydrotherapy Institute. And we actually certify practitioners to facilitate steams for their clients. So we have all kinds of practitioners, from registered nurses to doulas to midwives and so forth. So we're going to go a lot deeper into the nuances of steaming therapy and just talking about female reproductive wellness in general, and how it's kind of the education piece is really lacking in our culture. And so I really emphasize throughout you know, my presentation on Saturday the importance of kind of educating our clients around body literacy, really getting to know their bodies, and then using really non-invasive natural tools and remedies to kind of bring them back to balance. So that's what we're going to talk about in more depth on Saturday. And let's see if we have any more questions. So Wallace, we answered your question. Oh, you're welcome, you guys. Is there a special stool needed? No. Okay, so you have to remember that this is like a really humble therapy. You don't need anything special. you can do a really simple modified child's pose over like a ceramic pot of warmed steaming herbs. Some women actually set it up in their toilets. I don't really recommend that, but you can absolutely do it that way. And a lot of times what you can do is just kind of use one of your old chairs and drill a hole in it. And then to kind of retain the heat, you would do like a cloak in most situations. But it's not a complicated process. Once you kind of do it once, you get it down. And to teach our clients about it, it's the same thing. Once they get it down, they know how to do it. So I personally, I prescribe steam protocols. I don't actually facilitate them in clinic, but there's a lot of practitioners that actually facilitate them within their own clinic. Yanova Center is one over in New York with Jill Blakeway. She facilitates them, and it's kind of, excuse me, popping up everywhere, all over the place. Holly Lever in Los Angeles facilitates them in her clinic. Yeah. Okay, so you definitely don't need any special equipment. It is kind of nice to have a stool if you do see yourself incorporating it as a ritual. It's just easier. It's easier on your body, and it's more relaxing. You can kind of get into it a little bit more relaxed. Okay, so Christine, hi. Could you mention if this might help with hot flashes or vaginal atrophy? Yes, absolutely. So you have to remember that this therapy is circulatory. So it brings warmth and it brings chi and blood to an area. So for vaginal atrophy and for menopausal patients, it can actually restore organ function with kind of consistent use. And you can actually make more intention to your treatments by adding certain herbs to it, to the blend that they're actually steaming with. For hot flashes, we went over that a little bit earlier, but it can help with hot flashes. Of course, it's not like my go-to thing, like, oh, if you steam, your hot flashes are gonna go away. It can actually help it over time. But yeah, it's not like my first go-to thing to actually treat hot flashes. It's more kind of lifestyle education. What are you kind of eating and consuming? How's your liver health? Is there a lot of stagnation of emotions kind of thing? That it's kind of all over the place for hot flashes. But yeah, steaming can help with that. Yeah. Alrighty. Hi, one. Can a woman who has 24-day cycles steam? So you mean like the length of their menstrual cycle is 24 days? So it's like a short cycle? Is that what you mean? If so, if that's what you meant, yes, somebody with short cycles can steam, but there's a caution around short cycles. So a really good safe practice is post-period. So not steaming really any other time of the month, and then utilizing other kinds of modalities to try and help lengthen her cycle. Yeah. And the steaming would actually be really beneficial, especially if she has stagnation, blood stasis, old residue, that kind of stuff. All right, Stephen, hi. You're welcome, Christine. Okay, a nice chair to use is a commode. Yes, absolutely. Yeah, it's a chair you can usually get at a medical supply store. Absolutely. Yes. Movable pot. Yep, exactly. Thank you. Yeah, short cycles. Yeah, so you can steam with somebody with short cycles. You just have to use caution, and I normally don't recommend them steaming any other time of the cycle except after their period. That's kind of a safe protocol. Sandra Lee, have you found it helpful for PCOS? Yes. So for PCOS, there are a lot of different patterns that kind of feed into PCOS. So if you're introducing steaming therapy, you really have to pay attention to why you're introducing steaming and if it actually applies to whatever they're experiencing. So you say long scanty cycles. So long scanty cycles can actually be caused by several different patterns. So what you have to look at is if you want to introduce steaming, what is causing their long cycles? It has to be probably lack of flow. If there's any deficiency in there, you can supplement with internal herbs and nutritional food therapy. And the steaming would actually help to kind of shorten their cycles by introducing warmth and qi and blood circulation and softening of tension, if that's kind of a factor. With scanty cycles, I would say, steaming does kind of help nourish, but I would say that would take a lot more longer, like to nourish the root. For scanty cycles, that's more kind of, increasing organ function of the digestive system and just making sure that enough blood is being produced. Yeah. So sorry, I meant to say the flow is normal, just the cycle is extremely long. Yeah, so, like if they have, 60 days in between each period, what they can actually do to kind of introduce kind of a rhythm is to, when they start tracking their cycles from day one, they can start maybe steaming like maybe day 25, day 26, day 27, day 28 to try and encourage the flow of an on-time menstrual cycle. Yeah. All righty. Does anybody else have any questions? Unless they are trying to conceive. But with somebody with really long cycles like that, I would not even recommend them even try to conceive until they've had 3 regular cycles like in a row consecutively. And that's a really hard conversation to have with individuals and couples trying to conceive because they just want to get on the ball. But if they're having really long cycles like that, it's really unpredictable in when they're actually ovulating and when their fertile window is. So really having the conversation with them that 3 cycles of a regular, consistent menstrual cycle, is recommended before even trying to conceive. Okay. Yeah, so for that kind of individual, just before ovulation, I mean, before intercourse is a really nice time. But also post-period would be great for a couple consecutive days to make sure that all the old residue is shed, and then also to make sure that the womb stays nice and warm. Yeah. So no period for 9 months. The therapy could absolutely help bring on the period, but you also have to rule out if there's like a lot of deficiency associated with no period. So some women who are actually a little bit more excess and they're showing a lot of signs of excess and blood stasis and so forth, when you start steaming with that kind of a client, their period comes pretty quickly after you start a steaming protocol. But for individuals that are more deficient, and that's kind of one of the factors in why they're not getting their period, then that would take a lot longer and would require other kinds of things to help them along. Yeah. How much does the steaming treatment usually charge for? That's kind of up to you. Normally what I do is I just do consults. I do consultations with clients kind of all over the globe. And so I just charge for the consults, and they are responsible for kind of doing the setup at home and buying the herbs and so forth. But I mean, it kind of ranges what you can offer it in your own clinic. There is a group on Facebook. It's acupuncturists and steaming and acupuncturist, one or the other. And so you can start a conversation in there, a topic on what people are charging. Yeah. Alrighty. You're welcome. Thanks, guys. Any more questions? So I really do hope that there's a possibility of incorporating this into your practice. It's really, really effective. I feel like it's such a great way for clients to start integrating some self-care in a ritualistic way that helps to integrate and connect them with such a vital part of being a woman. So part of the healing process. All right. All righty. I'm gonna let Donna answer that question, Kane. Thank you, everybody.
Testing? Okay. Thank you guys for your patience with my mic here. Thank you, Chris, for today's class, and thank you everyone for joining us. As a reminder, her class is this Saturday, and we hope to see you there. The class this Saturday is a live webinar, so if you would like to receive CEUs, you do need to attend for the full day. Those are the rules of the licensing boards. However, it will be available for purchase as a distance learning CEU video on the following Tuesday, so next Tuesday. So if you want to do that and receive distance learning credit, you are more than welcome to do that too. That's it, everyone, and thank you so much. We will see you on Saturday. Bye.